So I've moved now from diagnosis into what I call pre-treatment. So before I can get treated to try to fight and remove the cancer that they found, I have to first do a whole slew more of tests. And I don't think I mentioned it before, but I have never really been sick. I didn't really have any experience with medical procedures, hospitals, various doctors, whatnot. Never had any kids of my own, never broke a bone, never had my appendix or tonsils removed, might have had a common cold every other year or so. So to all of a sudden find out that, I have cancer and I'm going to have to do chemotherapy, and I'm going to have to do surgery, and then they want to do genetic testing. It did become a little overwhelming, but I went forward and I had to go back in and I had to get another scan. And this time I had to lay down with the girls dangling through a couple holes, and they had a metal bar going down your sternum and underneath, you know, your breasts. And obviously a man invented that. No offense to the men watching the show, but holy heck, did that hurt. Literally the next day, I thought I had broken a rib. It was hard for me to breathe. It hurt to cough. And everybody I've talked to said the exact same thing. And especially if you're a bigger girl like I was, with bigger girls to dangle down, it was just extraordinarily uncomfortable. But they wanted to check on the cancer, I guess, one last time before they scheduled me for my surgery. So even now, got that scan, but I still had two more to do. I had to get my heart tested to make sure it was strong enough to handle the anesthesia and the drugs they were going to give me for chemo. I had to get an x-ray of my lungs to make sure my lungs were healthy enough. And all of that, is just a trip back and forth, back and forth, back and forth to Lewiston, which is, almost 2 hours from my house. But finally, that treatment is done, or pre-treatment, and they have me scheduled for surgery. Now, mind you, at this point, I still haven't heard from my oncologist. I haven't heard from anyone. Just heard that you've got surgery. And I'm like, well, what's happening? Why am I doing surgery before chemo? What's the benefit of that? And, angry woman, I marched into the cancer clinic demanding answers. And they're like, oh, well, you have a whole team working on it. And I might have said this in the last video, but it's important because it's like, well, aren't I part of the team? Aren't I like the receiver? Shouldn't I be communicating with the quarterback and the lineman to see, what route I need to take? I finally was able to get in to see the oncologist, and he did explain fairly well why they were doing the surgery prior to the chemo, and that's because they wanted to see, how aggressive it was, what stage it was at, and what they could gather up to use as a treatment against it. The genetic testing also helped with that determination. So I was BRCA1 positive, um, and my cancer ended up being stage 1, 3A. So cancer cells were active. As I mentioned before, triple negative is a pretty aggressive cancer, unfortunately, to get. So, day of surgery. I have to be there at dark 30, but I have to do pre-surgery check-in the day before. And they said they'll call me at 8. Wait at 8, no call. 8:30, no call. 9 o'clock, no call. My husband's like, just relax, they'll call you. Finally, I'm like, no, I'm not relaxing. I'm having surgery tomorrow. I don't know what time I'm supposed to be there. I don't know where I'm supposed to go. I don't know when I can stop eating, on and on and on. So I called And they're like, well, we don't have you down for surgery. And so I finally called a nursing, you know, lead. And she's like, oh, no, we have you down for surgery. They just forgot to put you down for your pre surgery consult. So, red flag one, well, this was actually red flag two, is you literally couldn't transfer from the surgical calendar onto the pre surgery calendar me. Okay, starting to lose a lot of faith in you. That was after nobody was talking to me from the cancer center. So 2 strikes. And I'm going to talk about strikes because this video or these videos are all about coulda, shoulda, wouldas and about a lot of what I learned. And looking back, I should have gone and gotten a second opinion. I wasn't feeling super comfortable with this place. But again, no medical history whatsoever, no medical experience. So I figured, breast cancer is common. A lot of women get it. A lot of women are treated by it. So let's just go. So I got that done. I called the hospital to see if there was lodging available. And that's something I'll talk about here later when I talk about finances. Is don't be shy to ask if they have medical housing available for patients, especially patients that are doing surgery, treatments, whatnot. And if you're traveling a far way away, you would be surprised what these places have to offer. So, fortunately, they did have free housing. The hospital I was being treated at was, you know, made by the nuns essentially, and so attached to the hospital was essentially, the dorms that the nuns used to live in. So we went up the night before, got a really nice dinner, kind of my last meal for the next 24 hours, and settled in. Went and saw a movie actually, and settled into this dorm. It wasn't uncomfortable. It wasn't, a 5-star resort either, but it was free. That's all that counts when you're looking at thousands upon thousands of dollars in healthcare bills. So the next morning I get up and we walk next door, literally to the hospital, and I get checked in. And they take me back to a room, and it's more like, I don't know. I was sharing it with a little girl, and I mean little, like 5. She was just bawling, and it kind of made me think, like, you don't have it so bad. Like, you're 45, and this is the first time you've been in a hospital, and look at this little girl. Like, no little kids should have to spend time in a hospital. So I sit around and wait, and they take me back to meet a nurse, and the nurse goes over what a chemo port is because they're going to put one in while I'm under. And the reason for a chemo port or cath port is to save your veins from the very harsh chemicals they're going to be pumping into you. And if you're getting it done repeatedly and over a longer period of time, it can really kind of save those veins. So what they do is and I can show you what a chemo port looks like. So that's it right there. There's 3 little dots in the middle, and then right in the center is where they inject the needle. But so this is put so it gets faster access to your heart, so it gets dispersed. And all I could think of is, if the chemicals are so dangerous for my veins, how can it be better to put it right into my heart? Well, again, it was explained to me that the heart will disperse it a lot faster than your veins. And so it'll get it diluted and get it out into your entire system rather than having it try to go up a vein and then into the heart and then disperse. So that made a little bit of sense, but it still seems counterintuitive to me. So she gets done talking to me, go back to my little room. The girl's gone, and I wait, and somebody comes and gets me. And I go back, and they look at the MRI, and while I'm in, essentially, it was very similar to how I got my mammogram. They put in a guide wire to kind of direct the surgeon to where that spot was. And, they numbed it with lidocaine, and it was really not for me uncomfortable. I thought I had a fairly high tolerance, high pain tolerance, but this wasn't that big of a deal. So I get done with that, and they're like, well, now we have to inject you with this radioactive dye so we can trace what lymph nodes the cancer would want to go to, so that the doctor can find those lymph nodes either by sight, or they must have had some piece of machinery that allowed them to hear that radioactive dye going through. So they're like, this might sting a little. Yeah, famous last words, kind of like that bar. This will only last a few minutes. You'll be fine. It's not that uncomfortable. So the two nurses stand on either side, and these are the same gals that were at my original mammogram scan a month ago, 2 weeks ago, can't even remember now, it's been so many years. And they inject this dye straight into your nip. Holy hell, that stings, it hurts. They're holding me up, telling me to breathe. I have tears streaming down my face. I'm damn near hyperventilating from the pain, and they're slowly injecting that dye through my nipple. So for those of you that have gotten nipple piercings, wow, kudos to you, because I mean, I don't think I could ever go through that level of pain again. So I finally get done. They have to give me a little bit of time to wait to have that go through my system, and then I go back and I get yet another scan. I can tell you right now, if you're claustrophobic, tell them up front, because you're going to spend a lot of time in a tube. I'm not claustrophobic, so it didn't really bother me. In fact, years ago when I worked for Wisconsin as a wildlife manager, I actually crawled into a bear den with a bear that I thought was tranquilized, only to come face to face with three little very awake faces, and was like, pull me out, because I was on a downhill decline to get into that little den, and it was snowy, so I had no grip. My boss is like, no, stay, you're the plug, those are just the cubs, they're not going to hurt you. It's like, well, thanks a lot, I'm not that fat. So got out of there. I'm still not claustrophobic even after that event. So now finally, after all of this, I get to have surgery. And if you've never had surgery, the surgical rooms are always cold. Your best friend is going to be the anesthesiologist. He or she may give you pre-drugs to kind of relax you before they give you the knockout drug. You wake up just like the videos you see of kids with their wisdom teeth just removed, that they're talking nonsense, they don't know where they're at. I'm sure I wasn't much different. So to all my friends that are in the medical field, do not tell your patient in the recovery room how things went. Because when I got back to that room, my husband's like, well, how'd it go? And I'm like, I don't know. And they're like, no, well, they told you in the recovery room. And I'm like, I was recovering. So yeah, don't know. But that's when it turned out that the margins were clear on this 1.4 centimeter, 1.7 centimeter lump that they removed, tumor, I should technically say, that they removed, and the lymph nodes were clear also. They only removed 2 of them. So surgery's done, but I realized I don't have a port. And they said, well, they couldn't put the port in because my veins were wonky, and my oncology surgeon didn't have the skill to get it in. So I needed to come back, because I love that drive back and forth, to meet with a vascular surgeon so that he could put it in. So surgery number 2 is coming up awful quick.